The following are the 13 categories of the IDEA classifications. Of the 13 categories of special education or disabilities, they are ordered and divided by prevalence, or the size of the category, which is either high incidence, which occurs more often, and low incidence, which occurs less frequently. This affects the ability to read, write, listen, speak, reason, or do math. Areas would be dyslexia, dysgraphia, dyscalculia, auditory processing disorder, nonverbal learning disabilities. Communication problems that include stuttering, impaired articulation, impaired language, or impaired voice. A below average intellectual ability. It ranges from mild to severe and often overlaps with low incidence disabilities. Poor communication, self-care, and communication skills are characteristics. Down syndrome would be an example. May include anxiety disorder, schizophrenia, bipolar disorder, obsessive-compulsive disorder, and depression. More than one condition covered by IDEA does not include deaf blindness. Criteria varies by state. Hearing loss not covered by deafness that may change or fluctuate over time, often confused with auditory processing disorder. Severe hearing impairment, unable to process language through hearing. An impairment to the body, regardless of cause, that affects a child's performance. Limits to a child's strength, energy, or alertness. Chronic or acute health problems such as asthma, ADHD, diabetes, epilepsy, hemophilia, leukemia, and Tourette syndrome are some examples. Includes both partial sight and blindness that negatively impacts learning. Affects verbal, nonverbal communication and social interaction. May impact behavior. Characteristics often associated are repetitive activities, stereotyped movements, resistance to change in routines, and unusual responses to sensory experiences. Hearing and visual impairments that cause severe communication and other developmental and educational needs where special education programs for the deaf or blind cannot be met. Acquired after birth because of an accident or some kind of physical force. In addition to the 13 categories, developmental delay applies to children 3 through 9, where it's difficult to identify or label a child specifically. It is a delay in one or more areas of physical, cognitive, communication, social, emotional, or adaptive development.